In this tutorial, we're going to continue with communication skills as a second part. So we'll look at good communication in healthcare. So what does it mean to have good communication? So we're interested in healthcare because as a practitioner, you need to know how to communicate well with patients. And so good communication would mean how well are you interacting with your patients. It might not just be with the patients because this is in healthcare. Healthcare has a lot of components other than just the patient, together with the fellow health practitioners and also the fellow health caregivers. How good are you communicating with them? And so, if we are talking about patients, patients prefer health workers who, one thing, so we are saying patients prefer health caregivers who, so what are the characteristics? What are the things that patients want to see in a health caregiver? Okay, so patients prefer one, they prefer people who have got warmth and empathy. So people who are empathetic and who have got that warmth are people who are highly loved. Because if you are empathetic, means you consider even the situation that someone is going in your own point of view. So you get to put yourself in the shoes of someone who is not feeling okay, someone who is sick, and you get to think as if it were you. So that is having a warmth, a empathetic heart, thinking as if it was you, putting yourself in the shoes of the person who is sick. And one being that just being that kind, that good, interactive with people, that is the warmth, so that people are going to be safe when they're near us. So patients prefer health practitioners who have got that warmth and empathetic, and also those who are easy to talk to. So are you easily able to be talked to, or maybe patients fear? So you need to be someone who patients can be able to talk to when they should be free to bring out even some things that they're hiding on their hearts. Trust me, there are a lot of people hiding a lot of things on their hearts, and we should, and if we just get to be warm, empathetic, just open, this is when we see that people are facing a lot of issues. And also patients really like those people who get to introduce themselves. So you need to make sure that as a practitioner or health caregiver, you get to introduce yourself when you are talking to a patient for the first time. Introduce yourself. Peradventure, even next time when they forget you, introduce yourself until they get to familiarize themselves to you. So that is very important, because how does just one gets to be free with interacting with this person they don't know? How about if that someone is come to attack them? So also patients appreciate those who appear to be confident. So as you get to speak to them, be that confident. Show that confidence that you really know what you are talking about. You really know your job prescription, and you really know your mission with that patient. So you need to be that confident as a health practitioner. And also patients appreciate health practitioners who listen and respond. Very, very important, listening and responding. So when you get to listen to them, also respond to them. That shows that you really care and you are really paying attention to them also. And also, if sick people or patients like people who get to ask questions. So are there some things that you need to know about the patients? Get to ask them, get to interact with them, and they are really going to appreciate that. So that is very, very important as a health practitioner to have. Easy to talk to, introduce yourself, appear confident, listen and respond, and also ask questions, and also that just have that warmth and empathy in you. And also, now, what is the purpose of communication in healthcare? Why do we communicate? So, the first reason of communicating in healthcare is to collect assessment data. So you need to collect data for an assessment. For example, in healthcare, when you want to find out some information about the patients, maybe there's a procedure that you need to take, you need to collect data for assessment. Or maybe this person is saying you want to find out what kind of sickness they have. Now, you can't just tell there and then. So you get to assess them, you get to ask questions, you get to communicate with them, and then they're going to be speaking to you. I'm feeling a headache, nausea, and this and this. So you're going to assess that data, and you can be able to tell what is wrong with the patient. And also to initiate intervention. That is why we get to communicate. Initiate intervention. So when you get to communicate with patients or when you get to communicate with people, you are making sure that when you get to listen to their side, you are going to do something. You just don't listen for nothing. So after listening, at the end, you should be able to do something. You need to initiate an intervention. What are you going to do? Now that you've heard that these people has got an headache, the stomach is paining, what are you going to do? So that is the reason of communication in healthcare. And also to evaluate outcome of intervention. So when you get to collect the data about a problem or something on the patient, and then you do something, so you are able to do something, you are also now going to evaluate. So what will be the outcome of what we are going to do? Is the patient going to be okay, or maybe this kind of problem that they have cannot be cured? So you are going to be able to evaluate when you get to talk to the patient or you get to communicate with them. You are going to evaluate what will be the outcome or the intervention or the thing that you are able to do for them. So apart from that, also to initiate change to help the health promotion. Initiate change to help promotion. All right. So when you get to communicate, you are going to initiate a change. There are some things that need to be changed, and the only way you can be able to change some things is when you get to listen to ideas of different people. You get to listen to the things that are affecting them. Perhaps even the kind of accommodation in the hospitals is not that good. Maybe the conditions of service are not good. There's no good water or safe water. So when you get to communicate, you are going to initiate change that is going to promote a health environment or a health service delivery. So that is why it is very important to get to communicate, so that you get to listen to even some things which are getting to affect people and you are going to do something about it. And also to take measures. So to take measures to be able to prevent some legal problems. Alright, so that is one also another purpose of communication. Take measures for preventing legal problems. So when you get to communicate with patients, you are going to be able to see the things that they are facing. And if there is need, for example, they are receiving mistreatments or things are not going well, or perhaps even the same patients are that brutal. So you are going to be able to take measures to prevent legal problems that have to do with tampering with the law of the land. So if there's any legal problems in health practice, you are able to do that. For example, maybe every time there are some problems that are arising maybe due to medicine. These patients are always complaining about medicine. There's no proper medicine delivery, or maybe they're always receiving medicine that is not the right one. So it is a right for people to have proper or good access to medical care. And so, if every time they cannot be able to receive this good medical care, you need to make sure that you take measures to prevent legal problems. If that is tampering with the law, you need to make sure that you get to have things that you are going to do to avoid anything that is going to tamper with also the law. And also, another thing is to analyze the effect, analyze factors affecting the health team. So when you get to communicate in healthcare delivery, when you get to communicate, you're not just communicating with the patients, you're also communicating with fellow health practitioners. So as you get to communicate with them, you are going to find out the factors that are affecting their operation. So you are also going to be able to analyze those factors, and at the end of it, or you are able to do something, because you just don't analyze the factors and you end there. So you are able to do something about it. And now let's look at the last component, that is the modes of communication. So on the modes of communication, the first mode of communication that we can talk about is verbal, and also non-verbal. So the verbal modes of communication and also the non-verbal modes of communication. Now, what are these? So when we are talking about the verbal modes of communication, this has to do with the actual speaking. So the way you get to use words. So some aspects of the verbal modes of communication, this has to do with now face to face interaction. How do you get to interact with people? These are the modes of communication. Verbally, that is face to face. You are with them, talking to them. Or it can be on a telephone. You are using your voice. That is verbal. And it can also be a radio or a TV where you are getting to listen to the voice. So these are the verbal modes of communication. And when it comes to non-verbal modes of communication, you have eye contact. You are not speaking a word, but just the way you are able to look at a person, they are able to see, they are able to get something within themselves. So for example, when you get to look at the opposite gender so much in the eyes, that can mean intimacy. So it gets to talk about a lot of things that you are thinking about them. So that is also another mode of communication. And also just the gestures that you are using, the way you are getting to show your hands, the way you are presenting yourself, like your kind of behavior, the way your body language. Okay, and also the touch. So that is also another mode of communication that is non-verbal. The way you get to touch people, that is a mode of communication, because it can mean really a lot of things, trust me. And also the tone of the voice. Are you raising the voice? Is your voice low? So just the tone of your voice, that is also another mode of communication. So this is verbal communication and also non-verbal communication. Of course, other things that we can talk about when it comes to modes of communication is, we can talk about written communication. So we've got verbal, non-verbal. We can also talk about written communication. This has to do with books and just other things. And also another mode can be listening. So you are just getting to pay attention to what people are getting to say. And it can also be visual, visual communication as a mode of communication. So what does it mean to when we are talking about visual communication? This has to do with visual aids, posters, it can be projectors, or even just some objects. So those are visual aids. So this was it for this tutorial about the modes of communication and just communication as a whole. Hope that was helpful. Thank you so much for watching. Enjoy the day.